Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Shahlla Masood Rao, working as consultant gynecologist in Trolley Hospital in Pakistan. Today I'm going to demonstrate an important gynecological skill, endometrial sampling. What is endometrial sampling? Endometrial sampling is a office-specific gynecological procedure to get the endometrial tissue in the specific gynecological conditions. So endometrial sampling can be done by the different methods like PEPEL, like Vabra, and diagnostic DNC, Sherman, and the gold standard is the hysteroscope. So these are all the methods to do the endometrial sampling. The PEPEL is the most important. As the PEPEL, you can see this is a plastic instrument that can be that is for the single use. It is around 12 centimeter long and it has the gradation over its outer surface. It has a plunger or the piston, or you can say it is stellate and a cylinder in which the endometrial tissue comes. Here is a point that is called the D point. This D point is a very important point that prevent this piston to completely withdrawn from this cylinder. So another important thing is the mechanism. What the mechanism is involved in doing the endometrial sampling by this triple cannula is when there's the rapid movement of this fully inserted piston to the maximum withdrawn of this cannula create the negative pressure inside the cylinder, which draws the endometrial tissue through this aperture into the lumen of the cylinder, and then you can put these tissues into the biopsy jar for the histopathology. But there are as you know, every procedure has certain indication, contraindication, and prerequisites and complications. Well, you have to be very sure about the indication. The indications are irregular vaginal bleeding, heavy menstrual bleeding of female age more than 45, postmenopausal bleeding. If the endometrial thickness is more than 4 millimeters, you have to check the efficacy of certain drug like tamoxifen before the hysterectomy. Or when you are going to have a workup of infertility and you want to confirm out the luteal phase insufficiency. These are the 7 indications. Then you have to be more sure about the prerequisites. The prerequisites are you have to introduce yourself to the patient, completely explain the pros and cons of the procedure to the patient and take the informed consent. You have to be very precisely tell about the complications as well. Then you have asked the patient to empty her, after taking the informed consent, ask the patient to empty her bladder, ask her to lie down on the dorsal position. There should be an adequate light and there should be the proper exposure of the patient. After fulfilling these prerequisites, rule out the contraindications. Contraindications are pregnancy, lower genital tract infection, carcinoma of endometrium, carcinoma of the cervix, and these are the certain important complications, certain important contraindication that you have to be very careful about. And other contraindication is the blood dyscrasias. So these are the contraindications. Regarding the complication, there could be the vaginal infections, vaginal bleeding or spotting, and there could be the lower abdominal pain as well as the uterine perforation. So although a little bit chance of that, but you have to tell the patient about all these contraindication indications as well as the prerequisites and complications. When the patient is comfortable, you can after taking the informed consent. Now this procedure consists of 2 components: setting up the trolley and performing the procedure, and tell the patient and follow up the patient along with that of histopathology report. For setting up the trolley, the things which are required for this is the sponge holding forceps, and these are the 3 Savlon swabs which are required to clean the vagina and vulva. Number 2 is this is the uterine sound. You can see here is here are the numbers over this uterine sound. This is pepel cannula. It is in the sterile packing. This is the tenaculum, sim speculum, and the gloves. This is the whole trolley, and this is the biopsy jar. This is the whole trolley which is required, or the whole tray which is required for the endometrial sampling. Now we will move forward for the procedure. First of all, you have to put on your gloves and clean the patient with this Savlon swab. You have to be very careful regarding the hygiene of the patient. After putting the gloves, this method, because it's a OPD procedure, so no need to stay the patient in the hospital. With the sponge holding forceps and these 3 Savlon swabs, you have to clean please come behind my back. So you have take the one Savlon swab and you have to move inside the uterus and rotatory movement from inside to the outside. So after one swab, then second swab, and then the third swab. By this, you can clean the vagina as well as the external pelvic surface. After that, you have to introduce your one glove and lubricated finger to do the bimanual examination. When you put the one finger to relieve the spasm of the muscle, then you have to put the second finger and do the bimanual examination to assess the uterine size, version, and mobility. After that, when you did the bimanual examination, you have to take the adequate size of the this Casco's speculum, and this procedure can also be performed with the same speculum and the tenaculum, but the most this is very helpful. I prefer this speculum of the duct speculum or the Casco's. You have to put the speculum and you have to expose the cervix. I will help you to expose the cervix. Now you can see the cervix is exposed. After exposure of the cervix, take the uterine sound and put the uterine sound to check the version and the size of the uterus. You can see from here, I have put the sound, show me from the upside. I have put the uterine sound that I can see the total version as well as the size of the uterus. You can assess the size from here and you can match the size with this with the gradation over the this pipelle cannula. Then you have to open the jar where you have a formalin. Now this is the cannula. Put the cannula inside the uterus till the fundus. You can see from upside. I have put the cannula till the fundus. If you can see from there, then I will move the piston and will move the cannula up with the rotatory movements, with the to and fro movement, so that we can get the maximum tissue from the uterus. When you are sure that the tissue has been taken in the maximum amount, you can withdraw the cannula and put this sample in the formalin filled jar. After putting the sample in the jar, cover the jar and write the name, date, time, name of the patient, ID number, relevant information if there is required for that, and follow up the patient along with that histopathology report. After this, you have to consult the patient regarding there could be the bleeding or the pain, and you can ask the patient for any analgesic, or you can prescribe analgesic for one day if there is any discomfort. But the patient should be informed before the procedure. This is very important component. And how you will send these samples, you have to send the samples in the formalin for the histopathology. If you want to send for the culture sensitivity, you can send the sample as such. And if you want to send the sample for Mycobacterium tuberculosis, you have to send in the normal saline as well as in LJ medium. And you have to remove this sim speculum, help the sim speculum, or if you are using the tenaculum, remove the tenaculum, help the patient to get dressed up, and thanks the patient and call her for follow-up. Thank you so much. Hope you will find this video very useful.